Have you ever wondered what it feels like to lose your brain 1 second at a time? I want you to picture something for me. Right now, as you are watching this video, somewhere in America, a clock is ticking. And every 40 seconds, that clock strikes. Not midnight, not noon. Every 40 seconds, someone in the United States has a stroke. By the time you finish watching the first 2 minutes of this video, 3 people will have already had one. Now here is what makes that truly terrifying. A landmark study published in the journal Stroke, led by Dr. Jeffrey Saver at UCLA, calculated exactly what happens inside your brain during those minutes. Every single minute a stroke goes untreated, you lose 1.9 million neurons. Let me say that again so it really sinks in. 1.9 million brain cells. Gone. Every 60 seconds. That is not a typo. That is not an exaggeration. That is cold, hard, peer-reviewed science. And those neurons, they do not grow back. They are gone forever. My name is Dr. Raymond Arens, and I have spent years watching people walk into emergency rooms with strokes. Some of them walked out weeks later, smiling, hugging their families, going back to their lives. And others? Others never walked again. The difference between those two outcomes was not luck. It was not genetics. It was not money. It was time. Specifically, it was what happened in the first 3 hours after their stroke began. That is what this video is about. I am going to teach you the FAST protocol, a simple test that could save your life or the life of someone you love. I am going to explain exactly what happens inside your brain when a stroke hits, why you have a very narrow window to act, and what you need to do the moment you suspect something is wrong. This is not optional information. This is not nice to know. For anyone over 50, and honestly, for anyone who loves someone over 50, this might be the most important video you watch this year. So let me start by explaining what a stroke actually is, because most people get this wrong. Think of your brain like a city, a massive, incredibly complex city with billions of residents, which are your neurons, your brain cells. Now, this city needs a constant supply of electricity and water to function. That electricity and water is your blood, carrying oxygen and nutrients to every corner of your brain. Your arteries are the highways and roads that deliver this supply. Now imagine one of those main highways suddenly gets blocked. Maybe a piece of debris, a blood clot, gets lodged right in the middle of the road. Traffic stops. No more water, no more electricity. The entire neighborhood downstream from that blockage goes dark. That is an ischemic stroke, and it accounts for roughly 87% of all strokes in the United States, according to the American Heart Association. It is by far the most common type. There is another type, a hemorrhagic stroke, where instead of a blockage, a blood vessel actually bursts open. Imagine a water main exploding in the middle of your city. Blood pours out where it should not be, flooding the surrounding tissue, crushing delicate structures. This type is less common but often more deadly. Either way, the result is the same. Brain cells start dying, and they start dying fast. Remember that number I gave you? 1.9 million neurons per minute. But it gets worse. Dr. Saver's research also showed that along with those neurons, you lose 14 billion synapses per minute. Synapses are the connections between your brain cells, the bridges that allow them to talk to each other. You also lose 12 kilometers of myelinated fibers every minute. Those are the insulated cables that transmit signals at high speed throughout your brain. Think about it this way. Imagine your brain is a massive computer network, the most powerful one ever built. During a stroke, someone is literally ripping out cables, smashing circuit boards, and destroying server rooms at an unimaginable pace, every single minute. And here is the comparison that still haunts me from Dr. Saver's study. He calculated that during a stroke, your brain ages 3.6 years every single hour it goes untreated. Let that sink in. 1 hour without treatment is like aging your brain almost 4 years in terms of neuron loss. 3 hours? That is like aging your brain more than a decade in a single morning. That is why neurologists have a saying, time is brain, every minute counts. Every second matters. Now let me tell you about Robert. Robert was 71 years old, a retired electrician from Ohio, the kind of man who could fix anything with his hands. He had been healthy most of his life. A little high blood pressure, sure, but his doctor had it managed. One Tuesday morning, Robert was sitting at his kitchen table eating breakfast, reading the newspaper, just like he did every single day for the past 20 years. His wife Linda was making coffee. Linda noticed something strange. Robert's coffee cup was shaking in his hand, not trembling like he was cold, shaking in a way she had never seen before. She looked at his face and one side of it was drooping, like the muscles had just quit working. She asked him if he was okay, and his words came out garbled like he was trying to talk underwater. Now here is where the story splits into two possible endings, and the ending Robert got depended entirely on what Linda did in the next 5 minutes. Linda had seen a public service announcement about the FAST test just 2 weeks earlier. She remembered it, and that memory saved her husband's life. FAST. Let me break this down for you because I need you to memorize this. I need you to tattoo this on your brain. I need you to know this the way you know your own phone number. F stands for face. Ask the person to smile. If one side of the face droops or does not move, that is a warning sign. It might look like a crooked smile, or one side of the mouth might hang down. A stands for arms. Ask the person to raise both arms above their head. If one arm drifts downward, or they cannot raise it at all, that is a warning sign. The weakness typically affects one side of the body. S stands for speech. Ask the person to repeat a simple sentence, something like "the sky is blue today." If their speech is slurred, if they cannot get the words out, if they are saying things that do not make sense, that is a warning sign. T stands for time, and this is the most critical letter of all. Time to call 911 immediately. Do not wait. Do not say, "Let me see if it gets better." Do not drive them to the hospital yourself. Call 911 because paramedics can begin treatment on the way and can alert the hospital to have the stroke team ready and waiting. The FAST test was originally developed in 1998 in the United Kingdom by a group of stroke physicians and ambulance personnel. Its purpose was simple but profound. Get stroke patients treated within that critical 3-hour window. A meta-analysis published in Frontiers in Neurology, reviewing multiple studies with over 6,000 participants, found that FAST has a sensitivity of around 77% for detecting acute ischemic stroke. That means it catches roughly 3 out of 4 strokes. It is not perfect, but it is simple enough that anyone, even a child, can learn it and use it in an emergency. There is actually an updated version called B-FAST, which adds B for balance, sudden loss of coordination, and E for eyes, sudden vision problems. Some stroke centers now prefer this version because the original FAST can miss certain types of strokes, particularly those affecting the back part of the brain. A study in the journal PMC showed that FAST misses up to 14% of strokes. But here is what matters most for you. Even the basic FAST test is infinitely better than doing nothing. And the vast majority of strokes it detects are the big, dangerous ones that need immediate treatment. But what I'm about to tell you next changes everything about how we think about stroke treatment. Let me tell you about the drug that changed stroke medicine forever. In 1995, the National Institute of Neurological Disorders and Stroke, or NINDS, published the results of a landmark clinical trial in the New England Journal of Medicine. This trial studied a drug called TPA, tissue plasminogen activator. Think of TPA as a chemical battering ram that breaks through blood clots. It is essentially a clot buster. 624 patients with ischemic stroke were randomly assigned to receive either TPA or a placebo within 3 hours of symptom onset. The results were stunning. Patients who received TPA within that 3-hour window were at least 30% more likely to have minimal or no disability 3 months later. 30%. In medicine, that is enormous. But here is the catch, and this is crucial. The FDA approved TPA for stroke treatment in 1996, making it the first and for many years the only approved treatment for acute ischemic stroke. The treatment window was 3 hours, 3 hours from the moment symptoms began. Not 3 hours from when you got to the hospital. Not 3 hours from when the doctor saw you. 3 hours from the very first sign that something was wrong. And the data showed that within that window, earlier was always better. The best outcomes in the NINDS trial were seen in patients treated within 90 minutes. 90 minutes. That is an hour and a half from the first symptom to having that clot-busting drug flowing through your veins. Now I want you to think about what happens in a typical stroke scenario. You notice something is wrong, maybe 10 minutes pass before you realize it is serious. You call 911, the ambulance takes 10 to 15 minutes to arrive. Another 15 to 20 minutes to get to the hospital. Then you need a CT scan to confirm it is an ischemic stroke and not a hemorrhagic one. Because if it is a hemorrhagic stroke, TPA would make it worse. That scan, the reading, the decision-making, that takes more time. By the time that needle goes in your arm, an hour or more has easily passed. You see how fast that clock runs out? Let me tell you about James. James was 57, a truck driver from Tennessee. Big guy, strong, never liked going to the doctor. His wife Patricia had been after him for years about his blood pressure and his weight. He always brushed it off. "I feel fine," he would say. "I am strong as an ox." One evening, James was watching football on the couch. He went to reach for his drink and his right arm just would not cooperate. It felt heavy, like someone had attached a weight to it. He thought maybe he had slept on it wrong, that it was just pins and needles. So he waited. He shook his arm. He waited some more. 20 minutes went by, then 30. His speech started getting fuzzy. Patricia walked in and immediately knew something was wrong. She called 911. By the time James arrived at the emergency room, almost 2 hours had passed since that first sign with his arm. James received TPA. He survived. But because of that delay, those lost minutes of him sitting on the couch thinking it would pass, James lost significant function on his right side. He had to retire from his job. He needed months of rehabilitation. He can walk now, but with a limp. His right hand never fully recovered its strength. Every neurologist who has treated stroke patients has a James. A patient where you think, if only they had called sooner. If only they had not waited to see if it would go away. Here is something that most people do not realize. Sometimes stroke symptoms appear and then seem to go away on their own. You feel your face go numb, your arm gets weak, and then 5 or 10 minutes later, everything seems normal again. Many people think, "Oh good, it passed, it was nothing." That is one of the most dangerous assumptions you can make. What you probably experienced was a transient ischemic attack, or TIA, sometimes called a mini-stroke. Think of it as a warning shot across the bow. A TIA happens when a clot temporarily blocks blood flow to the brain but then dissolves on its own. The symptoms disappear, and you feel fine. But here is what the research tells us. According to the American Stroke Association, up to 1 in 3 people who have a TIA will eventually have a full-blown stroke if the underlying cause is not treated, and about half of those strokes happen within the first few days after the TIA. Days, not weeks, not months, days. So if you ever experience stroke symptoms that go away, do not celebrate. Go to the emergency room immediately. A TIA is your brain sending you a telegram that says, "A storm is coming, take cover now." Now I need you to hear what I am about to say, because it could be the most important thing in this entire video. You might be thinking, "Okay, Dr. Arens, I have 3 hours to get to the hospital. That is plenty of time." Let me correct that thinking right now. 3 hours is the maximum. It is the outer edge of the window. It is not a comfortable cushion, it is a deadline, and every minute you waste before that deadline, you are losing brain tissue that you will never get back. Remember Dr. Saver's calculations. In 3 hours, you could lose over 340 million neurons. That is 340 million brain cells that controlled your ability to speak, to move, to think, to remember your grandchildren's names. In 2008, the European Cooperative Acute Stroke Study, known as ECAS-3, published results in the New England Journal of Medicine showing that TPA could still be beneficial up to 4.5 hours after symptom onset in certain patients. This was a significant finding because it gave some patients a slightly wider window. However, the benefits decreased with every passing minute. The American Heart Association updated its guidelines to reflect this extended window, but the FDA never expanded the official approval beyond 3 hours in the United States. So yes, in some cases, treatment might still be possible up to 4.5 hours. But here is what I tell my patients. Do not bank on 4.5 hours. Act as if you have 1 hour, because the data is crystal clear. The sooner you are treated, the better your outcome. Period. Before I tell you about the incredible new treatment that has completely revolutionized stroke care, I want to ask you something. If this information is helpful to you, if you think this could save someone's life, please hit that subscribe button right now and leave me a comment telling me where you are watching from. I would love to know how far this message is reaching, because every person who hears this and remembers fast could save a life someday. Maybe their own, maybe their partners, maybe their parents. All right, now let me tell you about the breakthrough that changed everything. For decades, TPA was our only weapon against ischemic stroke. It was good, but it had a major limitation. It works by dissolving clots chemically. But what if the clot is too big? What if it is lodged in one of the major arteries feeding your brain? TPA alone can dissolve a lot of clots, but for large vessel occlusions, the clots blocking the biggest and most critical arteries, it struggled. Studies showed that TPA alone could only recanalize or reopen large vessel occlusions in as few as 4 to 8% of cases. Then came 2015, a year that neurologists will never forget. 5 major randomized clinical trials were published almost simultaneously in the New England Journal of Medicine. Mr. Clean from the Netherlands, Escape from Canada, Extend IA from Australia, Swift Prime, and Reviscat. All 5 demonstrated the same remarkable finding. A procedure called mechanical thrombectomy was dramatically more effective than medication alone for large vessel strokes. Mechanical thrombectomy is exactly what it sounds like. A neurointerventionalist, a specially trained doctor, threads a thin catheter through your blood vessels, usually starting from the groin, navigates it all the way up to the blocked artery in your brain, and physically removes the clot. Sometimes they use a device called a stent retriever, which is like a tiny expandable cage that grabs the clot and pulls it out. Other times, they use aspiration, essentially a tiny vacuum that sucks the clot away. The results from these trials were staggering. In the Swift Prime trial, 60% of patients who received thrombectomy achieved functional independence at 90 days, compared to only 35% in the medication-only group. Extend IA showed functional independence in 71% of the thrombectomy group versus 41% with medication alone. These numbers are extraordinary in stroke medicine. Think of it this way. If TPA is like using a garden hose to put out a fire, mechanical thrombectomy is like sending in the fire department with a full truck and a ladder crew. Both can help, but for the big fires, the big clots, you need the full response. But what truly blew the doors open was what came next. In 2018, 2 more trials changed the game again. The Dawn trial and Diffuse 3 demonstrated that in carefully selected patients, those with evidence of salvageable brain tissue on advanced imaging, mechanical thrombectomy could be beneficial up to 24 hours after symptom onset. 24 hours. Now, I need to be very careful here because I do not want you to hear 24 hours and think you can take your time. That extended window only applies to a very specific subset of patients, those who have what doctors call a mismatch, a significant area of brain that is struggling but not yet dead, brain tissue that can still be saved. And even in those patients, sooner is always better. But for stroke medicine, this was nothing short of a revolution. Patients who previously would have been told it is too late, sorry, there is nothing we can do, were now being treated successfully. Let me tell you about Linda. Not Robert's wife, Linda. A different Linda. Linda was 64, a retired school teacher from Michigan. She woke up one morning and could not move her left side. Her daughter found her 2 hours later. By the time she reached a comprehensive stroke center, almost 5 hours had passed. In the old days, before thrombectomy, Linda's prognosis would have been grim. The TPA window was closing or already closed, but the stroke team did advanced imaging that showed a large clot in her middle cerebral artery. one of the major highways of the brain. And critically, the imaging showed that while some brain tissue had already died, a large area around it was still alive, still salvageable, still fighting for survival. They took Linda to the interventional suite. A neurointerventionalist threaded a catheter up through her femoral artery in her groin, navigated it through the twists and turns of her vascular system, right up to that clot in her brain. Using a stent retriever, they captured the clot and pulled it out. Blood flow was restored. 3 months later, Linda was back to volunteering at her church. She walks, she talks, she drives, she plays with her grandchildren. Without that procedure, she almost certainly would have been permanently disabled or worse. That is the power of modern stroke medicine when time is on your side. But let me flip the script for a moment and talk about something that is just as important as getting treatment fast, and that is prevention. Because the best stroke is the one that never happens. According to the Centers for Disease Control and Prevention, more than 795,000 Americans have a stroke every year. That is roughly 1 stroke every 40 seconds. Every 3 minutes and 14 seconds, someone in this country dies from a stroke. It is the 5th leading cause of death in the United States and the leading cause of serious long-term disability. But here is the good news. Up to 80% of strokes are preventable. 80%. That means if 10 people were going to have a stroke this year, 8 of those strokes could have been avoided. The World Stroke Organization's 2025 Global Stroke Fact Sheet, which pulled data from the Global Burden of Disease study, reported that metabolic risk factors, things like high blood pressure, high blood sugar, high cholesterol, and obesity, contributed to 69% of all strokes worldwide. 69%. Let me break down the biggest risk factors and what you can do about each one. Number 1. High blood pressure. This is the single biggest risk factor for stroke, and it is one of the most treatable. High blood pressure damages your blood vessels over time. Think of it like running water through a garden hose at triple the normal pressure. Eventually the hose starts to crack, weaken, and bulge. Those weakened spots in your blood vessels are exactly where clots can form or where vessels can burst. What to do? Get your blood pressure checked regularly. If your doctor prescribes medication, take it. Every single day. Not just when you remember. Not just when you feel bad, every day. And if you can make lifestyle changes, reducing salt, exercising, managing stress, even better. Number 2. Atrial fibrillation, or AFib. This is an irregular heart rhythm that affects millions of Americans, especially those over 65. When your heart beats irregularly, blood can pool in the chambers of your heart. That pooled blood can form clots, and those clots can travel straight to your brain. People with AFib are 5 times more likely to have a stroke. What to do? If you have been diagnosed with AFib, talk to your doctor about blood thinners. This is not something to mess around with, and if you ever feel your heart fluttering, racing, or beating irregularly, get it checked out. Number 3. Diabetes. High blood sugar damages blood vessels throughout your body, including the ones in your brain. Over time, it makes those vessels stiffer, narrower, and more prone to blockages. Having diabetes roughly doubles your risk of stroke. What to do? Manage your blood sugar carefully. Follow your doctor's recommendations on medication, diet, and exercise. Monitor your levels regularly. Number 4. Smoking. Every cigarette you smoke damages the lining of your blood vessels. It thickens your blood, making clots more likely. It raises your blood pressure. It accelerates the buildup of fatty plaques in your arteries. Smoking doubles your stroke risk compared to non-smokers. What to do? Quit. I know it is hard. I know you have heard it 1,000 times. But here is something you may not know. Within just 2 to 5 years of quitting, your stroke risk drops to nearly the same level as someone who has never smoked. Your body wants to heal. Give it the chance. Number 5. Physical inactivity and obesity. A sedentary lifestyle and carrying excess weight increase your risk for high blood pressure, diabetes, and heart disease, all of which are stroke risk factors. What to do? You do not need to run a marathon. 30 minutes of moderate activity most days, even walking, can make a significant difference. Take a walk after dinner, garden, play with your grandkids, move your body. Now let me share something that might surprise you. According to a CDC data brief published in 2024, the stroke death rate among Americans aged 45 to 64 had been declining for years, dropping from about 24 per 100,000 in 2002 to about 20 in 2012. Great news, right? But then something troubling happened. From 2012 to 2021, stroke death rates in that age group actually increased by more than 20%. The rate climbed from 20.2 to 24.4 per 100,000. Stroke was supposed to be going away, and instead it was coming back. Researchers believe rising obesity rates, increased prevalence of diabetes, and other factors may be driving this reversal. This is not someone else's problem. This is our problem, right now, today. So let me give you a practical action plan. Things you can do today, this week, to protect yourself. First, memorize fast. Face, arms, speech, time. Say it out loud right now. Teach it to your spouse. Teach it to your children. Teach it to your grandchildren. Put it on your refrigerator. Second, know your numbers. Blood pressure, blood sugar, cholesterol. If you do not know them, make an appointment with your doctor this week, not next month. This week. Third, if you are on medication for blood pressure, cholesterol, diabetes, or AFib, take it as prescribed. Do not skip doses. Do not stop because you feel fine. You feel fine because the medication is working. Fourth, if you experience any stroke symptom, even for just a few minutes, call 911 immediately. Do not wait to see if it happens again. Do not take an aspirin and lie down. Do not call your adult children for advice. Call 911 first. Fifth, know where your nearest comprehensive stroke center is. Not all hospitals are equipped to perform mechanical thrombectomy. In a stroke emergency, you want to get to a hospital that can do everything, TPA and thrombectomy if needed. You can search for certified stroke centers on the Joint Commission's website. Sixth, if you call 911 for a possible stroke, tell the dispatcher you suspect a stroke. Those words trigger a specific protocol. The ambulance team will alert the hospital. The stroke team will be assembled and ready when you arrive. Every minute saved in that chain is brain tissue preserved. Now let me leave you with something I think about often. I have treated hundreds of stroke patients over the course of my career, and there is one moment that stays with me more than any other. It was a woman, Patricia, 69 years old. She came in after her husband Mike recognized the signs of a stroke immediately. Mike had watched a video about the FAST protocol just a month earlier. When Patricia's face drooped and her speech slurred during Sunday dinner, Mike did not hesitate. He called 911 within 2 minutes. Patricia received TPA within 45 minutes of symptom onset. 45 minutes. The stroke team later told me that the imaging showed a significant clot in her middle cerebral artery. Without treatment, Patricia would have lost the ability to speak, possibly permanently. She might have lost use of her right side. She might have needed full-time care for the rest of her life. Instead, 48 hours later, Patricia was sitting up in her hospital bed, talking, laughing, complaining about the hospital food. Within a week, she was home. Within a month, she was back to her normal routine. Mike saved her life. Not with CPR, not with surgery, not with some heroic physical act. He saved her life by knowing 4 letters. FAST. You now have the same knowledge Mike had. The question is, will you remember it when it matters? Will you act when seconds count? Will you be the person who makes the call, who refuses to wait, who says no, we are going to the hospital right now? I truly believe that the information in this video has the power to save lives. Not theoretically, not hypothetically. Real lives, real families, real stories with happy endings instead of tragic ones. If you found this helpful, please share it with someone you love. Send it to your mom, your dad, your spouse, your neighbor. Share it in your church group or your community center, because you never know who needs to hear this today. Subscribe to this channel for more videos like this one. I have got more coming on heart health, brain health, and all the things you need to know to live a longer, healthier, more independent life. My name is Dr. Raymond Arens. Remember, time is brain, and fast saves lives. God bless you and your family. Take care of yourselves, and I will see you in the next video.